In the bid to improve the rapid response and emergency services in the country, the Ministry of Health has dispatched over 116 ambulances to various constituencies in different parts of the country. The Prime Minister Robinah Nabanja, who was the chief guest at the flag-off exercise of the newly procured ambulances, said Ministry of Health requires close to 20 billion shillings towards managing both road and marine ambulances.
The government plans to procure an additional 180 ambulances of Type B and Type C. In terms of operational costs, the Ministry of Health indicated that it needs Uganda shillings 20 billion to manage both the road and the marine ambulances services in Uganda.
The number of ambulances required are 591, and the gap now is 317. So out of the 353 constituencies, 100 have standard Type B ambulances, plus 92 in this lot, giving us 192. There is a deficit, as I have mentioned, but we shall continue to procure.
So we appreciate the Ministry of Health that has procured all these ambulances that are being distributed in the country, and definitely this will go a long way in strengthening healthcare provision. Our appeal is that the hospital administrators and managers and the drivers should use the ambulances for the purposes they are intended to.
The top management at the Ministry of Health underscores the need to have air ambulances to manage emergencies in hard-to-reach areas. Apparently, the Ministry of Health is counting on Ministry of Finance, Planning and Economic Development to release funds and also support from the development partners.
We want you to advocate for more funding, because without operational cost, those ambulances will be white elephant in the facilities, in the constituencies. We are going to allocate each ambulance with a fuel card. And that fuel card, we don't want really to, we don't want to send money and then somehow it is yoked up with other things. This money should be on the fuel card. And we want the cows to make sure that this fuel we are using is not for something else.
My opinion, if we fixed all the health center falls in this country, there would be no need for emergency referrals. As soon as we are done with the ambulances, I think we also now need to start looking at the health center falls. Secondly, the ministry should map spots on highways.
But what do some of the beneficiaries say about the ambulances handed over to them?
Many lives are lost because there is no ambulance to rush them from point A to B to get treatment. But now, if government has taken this step to bring so many ambulances.
From the Albertine region, we are having a good road network, and that has caused the rise of the road accidents, the road carnages. Honestly, with this kind of facility, the ambulance we have gotten today, with a combination of other private-owned ambulances, I know we're going to handle the rapid response.
Ambulances are going to the constituencies, are going to help the communities. We really want to see a reduction in maternal mortality. We want to see a reduction in child mortality, because we shall have the transport.
Sure that the ambulances are put to effective use. We will monitor through the routine programs, and we will also monitor through the staffing who will be deployed there on the ambulance services, and also where it will be parked and its routine activities. Misuse procedures are there, legal and all that. The formal procedures will always be followed. Yeah, and we will take it head on.
Zahara Abigaba, UBC News.